Hi everyone and welcome back to my channel. This video is very important because this video is about health. In this video, we will go through what are the various health insurance options that we have available in Germany. What are the pros and cons? How much do they cost? And what are the things that they do cover? And what are the things they don't? And many other details. So let's get to it. Healthcare system is divided into two types. The first one is public health insurance and the second one is private health insurance. Any legal resident in Germany, they're obliged to opt any of these health insurances in Germany, whether they are employees, employers, if they're a student, unemployed, everyone has to have a health insurance. Let's talk about public health insurance. So the first question is, who can get public health insurance? So if you're someone who is employed and if you earn less than 69,300 as of 2024, you are allowed or you have the option to go for public health insurance. If you're a student whose age is less than 30 years old, you have the option to go with public health insurance. If you are a family member of someone who already has a public health insurance, for example, you are a wife and your husband has public health insurance and you do not work, then you can also come under the family health insurance. This would not increase the money or the premium for your husband and you can be covered under your husband's health insurance. Same goes for the kids. So the spouses and the kids will be covered under husband's health insurance if the wife is not working. Now there's a small change. For example, if the wife is not working but she is doing some kind of a freelance work or maybe a small mini job, then if you still earn less than 538, which is the limit for mini job, or if you're doing any other part-time job and if you're earning less than 520 euros, then you can still be under your husband's health insurance. So, which is one of the very nice things and one of the highest advantages of public health insurance. Now let's talk about how much this public health insurance costs. So these public health insurances usually charge around 14.6% plus an average additional charge of 1.3% of your gross annual income. But if you're an employee, your employer and you will divide this number and you will be paying 7.3% of this 14.6% and the remaining half will be paid by your employer. So this is one of the nice things to be employed, that 14.6% is a lot. So if you're employed, your employer will be paying half of it and you will be paying half of it depending on how much you earn. Now here, if you earn more, which means you will be paying more health insurance, and if you're earning less, then of course you will be paying less health insurance, which is kind of like people usually go for the private health insurance because of this, because they feel that this 14.6% is way too high, and especially when you earn more than 69,300, which is the limit. So when you earn more than 69,300 annual, you have the choice to go with the private health insurance, which is a lot cheaper than this for 14.6%, which we will discuss a little bit later. But let's move on with the remaining details of public health insurance. So now let's talk about what are the things that the public health insurance usually cover. So they usually cover all your doctor appointments, your all in-hospital treatments, all your medical prescriptions, all the surgeries, maybe maternity services, and the basic dental care. So, and this is similar with all other public health insurances. So one of the common health insurances in Germany are here. So here is the list of all the public health insurance is in Germany. Mostly the services are similar with some minor differences. For example, if you are an expat and if you would like to have the customer service in English, then TK has their customer service in English, and I think they also have the app in English. So it gets quite easier to get the consultation, or if you need to ask something. So this gets quite easier for someone who does not speak German. With my health insurance, I have to do all the communication in German. So these are some of the examples, and I already gave you an example of all the things that they usually cover. Now, what are the things that they don't cover? For example, if you have already a prescribed medicine and you go to the pharmacy, so you might have to pay on top €5 to €10. So far, for all my medicines that I've been to a pharmacy, I always had to pay minimum €5 on top. Everything else would be covered by your insurance. You just have to pay €5. And if it's some medicine that is very expensive, so you might also have to pay up to €10. But for my insurance, so far I've only paid €5 on top. And the second thing that they don't cover is, for example, if you get, for some reason, admitted at the hospital, and if you have to stay the night, maybe 1 night, 2 nights, or maybe more, so you have to pay €10 per day for all the nights that you will be staying at the hospital. The treatment itself or the surgery, everything else would be covered, but you have to pay for the bed, which is €10 per day. Third thing that is not covered in the public health insurance is your dental care. For example, they do cover all the basic treatment, or I would say all the cheapest treatment. So if you go to a doctor to get a consultation, and if they give you some painkillers or something like that, that is usually covered. And if you have to do a filling or something like that, then they do pay for the filling as well, but you have to choose the cheapest one. So the dentist usually gives you 2 options. One is the cheapest one, and the other one is, I think, composite one, which is a much better one. So if you choose the better one, which is much stronger, then you have to pay on your own, which is around from €80 to €150 for 1 tooth. Now, in this case, for example, in my case, I also have a private dental insurance, which I pay around, I think, €16 per month. So everything that my public health insurance does not cover, they do cover everything else. But if you do need information about that, you can leave a comment. I will get back to you and I can give you more information about that. But here we will be talking about the health insurance. So like I said, these 3 things they usually do not cover. Everything else is usually covered. Now let's talk about the private health insurance. So first things first, so let's talk about who is eligible to go with private health insurance. So if you're someone who is earning, if you're employed, and if you're someone who is earning more than 69,300 per year, then you have the option to go with private health insurance. If you're someone who is not employed by an employer, but if you are a freelancer, and if you do some freelance work here and there, then you can go with the private health insurance. If you are a student who is whose age is more than 30 years old, then you can go with private health insurance. And if you're also some kind of guest scientist here or someone on scholarship without a contract, then you can also go with private health insurance. If you're also someone who is here to learn the language and who is only here for a short amount of time, then you can also go with the private health insurance, which is a lot cheaper. When I was a student, I did not go with the public insurance. I went with the private health insurance because it was a lot cheaper. So we're talking about, I was paying, I think, around €35 a month compared to €110 for the public health insurance when I was a student. So it also depends what is important for you. But there are also pros and cons of both of them, which I will get to in a minute once we complete all the information regarding the private health insurance. So now the next question is how much the private health insurance cost. So like I already mentioned that when I was a student, I was paying around 35 euro per month as a student. But if you're employed, maybe this range would be from around 150 euro to up to 1,000 euro a month. But it also depends because there's no fixed amount like in public health insurance where you pay 14.6%. But here it really depends first on your age, your health status, your profession, what do you do? For example, if you're someone who works a highly risky job, then this can affect the cost of your insurance. And if you want to add any additional services to your insurance, then it could also depend on that. So there's no fixed amount. It depends which health insurance provider you choose and what are the services that you add into your service. But in general, this costs a lot cheaper than the public insurance. But there are also some tricky points that you need to be careful, which I will discuss at the end of the video. But in general, if you want to know more about these health insurance providers, here is a list. There are way too many in Germany, but here is one of the most famous ones in Germany, which you can look into and get more details. I cannot personally recommend anyone because as an employed person, I don't have the private insurance yet. But as a student, if someone is student and who would like to know, then I can maybe recommend one. But for employees, I don't personally have a personal recommendation because I don't have my personal experience with it. But you can look up about these insurances and maybe you can get some more info. So let's quickly compare the pros and cons of both private and the public health insurance. So let's talk about first, which is the most complicated sometimes in Germany, that is getting an appointment. With the public health insurance, sometimes if you call to a doctor or something, you might get an appointment in maybe a month or so. Yes, that is possible. Like in my home country, you can just go right away, but here it's not like that. So you might have to wait up to a month in order to get an appointment. Sometimes it's more than a month, 2 months, 3 months. But with the private health insurance, getting an appointment is a little bit easier because then you can also go to the private hospitals. So in terms of getting an appointment, I would say private health insurance is better. Now the second one is cost. Like I already mentioned before, that public health insurance is a little bit expensive compared to private health insurance. Because your public health insurance is based on your income. So if you're earning more, then which means you would be paying more into your health insurance. And if you're earning less, you pay a little bit less. But in private health insurance, this amount would be fixed each month regardless of your gross income. So here I don't really put any of these above or below, but I think it really depends on your personal situation, how much you're earning and which one could suit you better. So that's the second one. Now the third one is also regarding the cost, but in a different way. For example, in public health insurance, you get your card, your Versicherung card, your health insurance card. And whenever you go to a doctor, you just show your card and then they have all your data and you do not pay anything. But with the private health insurance, when you go to a doctor, you will be paying the bill at the doctor's office, maybe at the doctor's office, or you can also get the bill via post, and you have up to 30 days to pay on your own first, and then you will be reimbursed. So for some people, this is not very easy because sometimes these costs would be higher. For example, if something is going to cost me 500 to 1,000 euro, and maybe I don't have that much money in hand that month to pay in first and then wait for the reimbursement. So this again really depends on your health situation. When I was a student, it was quite easy because I was very healthy. I never really had to go to a doctor too many times. So for me, it was okay to pay up to 300 euros upfront, and then I will be reimbursed within a month. So as a student, it was okay for me. But if you're someone with pre-existing condition or if you feel like you might have to go to the doctor quite often, then maybe public health insurance is something that is more suitable for you based on the cost that you might not be able to pay upfront. So it really depends on your situation, but I think here it's public health insurance is better compared to private in this situation. Now, one other most important thing that is regarding your family members. So in public health insurance, if your wife or your spouse, like I've already mentioned, if they do not work, they come under your health insurance, and your insurance becomes family health insurance. If they do not work, or if they earn about less than 505 euros, or if they're doing only a mini job, they would be covered with your health insurance. So your partner or your children, they don't have to go with additional health insurance. But in private health insurance, they don't have this option, which means your family will not be covered under your healthcare plan. So here, maybe your family members and everyone who is in the house, they will have to go with their own health insurance. But again, it depends. If both the partners are working, this is completely fine. But if one of the partners is not working, that could cost you a little bit more. But in general, overall, private health insurance have more better deals, which means they cover more than what public health insurance covers. But again, it really depends on your personal situation. So like I've mentioned a lot of points. So before you make a decision, just think through on each point what suits you better. For example, if you want to know my personal recommendation, then at this stage, I'm better with my public health insurance. But as soon as I earn a little bit more, which means I would have to pay more to health insurance, then I will rethink about my situation. So you can change or you can switch to the private health insurance at a later point as well. So again, this is completely based on your personal situation. But if you have any question, if something is not clear from this video, you can always leave a comment and I will try to get back to you. Or if it's something very complicated, I will try to make another video. But until then, I wish you very good health, stay safe, and take care of yourself and choose your health provider wisely. But until then, thank you so much for watching and see you in the next video.